The focus on Black people. We tackle the topics that keep you up at night: mental health, chronic conditions, preventive care, sexual health, men's health, women's health, heart disease, and much more. All with the cultural context that matters, because our Black doctors understand the unique challenges we face. Here is what you can expect: real talk from doctors who look like you and get it, lived experience testimonies, practical advice, illness prevention and management tips, and a space of understanding without judgment. You also get to ask questions. Your questions drive the conversation. Health Hour, where community meets Black health expertise.
Good morning, everyone. Welcome to Khan Health Hour. So happy to have you here. My name is Amaka and I'll be your host this morning. I am a women's and children's specialist pharmacist. And today we are going to be covering a really important topic called early pregnancy. And we are going to be joined by the esteemed obstetric and gynecologist, Dr. Natalie Nunes. I've got a little bio to read out just so you guys can get acquainted and know our speaker today. So she's a consultant gynecologist with over 25 years of experience specializing in early pregnancy care. She provides compassionate, evidence-based management of miscarriage, ectopic pregnancy, and complex early pregnancy conditions. She's a recognized innovator, and she actually introduced virtual reality headsets to reduce pain and anxiety during awake miscarriage procedures, which combines empathy with technology to improve women's experiences. So I think we can all agree in this age where AI and digital health are rapidly expanding and growing, it's so important to have an advocate that will put our voices first and our needs first and our struggles. So we're very privileged to have Dr. Natalie Nunes, who actually won the Women's Digital Health Solutions as a Women's Health Practitioner Award at the Black Healthcare Awards 2025. So congratulations to her for that. But yeah, all that to say, very privileged and very excited to have Dr. Natalie Nunes here today. And without further ado, I will hand over to her. She's going to have her presentation and then we're going to have a Q&A session at the end. So if you guys have got any questions, just put it in the bio and we will cover that at the end. So thank you all for joining wherever you are in the country. And I'm going to hand it over to you, Dr. Natalie. Thank you for being here.
Thank you very much. And hello, everyone. Can you see my slides? Yeah, perfect, perfect. Okay. So I'm going to share about early pregnancy, some of the things that you need to know. Okay, so I'm going to talk about not just early pregnancy, but preparing for the pregnancy, things you should be doing before you even get pregnant, early signs of pregnancy, what's happening in your body, your first appointments, some common symptoms, some warning signs, and then I'm going to talk in a little bit more detail about some important conditions and about looking after yourself. Okay, so preparing for pregnancy, what should you be doing before you start trying to conceive? And, you know, sometimes pregnancy is unexpected. But for somebody who's on, for example, medication that we don't want you to take during pregnancy, or if you don't want to be pregnant right now, it's really important that you use reliable contraception. And if you're on medication that you don't want to be taking during pregnancy, or your doctor has told you you should not be taking during pregnancy, then it's important to go for pre-pregnancy counseling to know, okay, I want to start trying now. What should I be changing this medication? So before you get pregnant, they can optimize your health, for example, control of your diabetes, or changing medication to a preparation that's safe to use in pregnancy. Then folic acid. It's best to be taking folic acid before you even conceive, preferably maybe 3 months before. So if you think you want to get pregnant, then you should be starting your folic acid. Review your medications with your GP, or as I mentioned, pre-pregnancy counseling, whether it's epilepsy or blood pressure. There are safer preparations that you can take during pregnancy, and your doctor can change you to that before you get pregnant, as opposed to getting pregnant and then thinking you need to stop it and your health condition becomes uncontrolled. Check your vaccinations. What vaccinations should you have prior to getting pregnant? Stopping smoking, avoiding alcohol, limiting caffeine, healthy weight, balanced diet. Vitamin D is really quite important, especially as we're going into winter. Not as much sun. We had a good summer, but not so much sun right now. So really important with the vitamin D, especially for people of color. We get less because of our melanin. We absorb less of the sun that creates the vitamin D in our skin. So quite often, even in the summer in the UK, people of color can be vitamin D deficient, leaving you quite tired. So really important to plan ahead. Okay. So we've already heard about me, 25 years, over 25 years as a medical doctor. I also took 3 years out of my training to do an advanced research degree in ultrasound and early pregnancy and gynecology. Okay, first signs. Okay, the first thing is often the missed period. But for you to realize that you've missed a period, you have to be tracking your period. There are so many apps out there that allow you to track your period, and it will tell you when you're ovulating, which is the time that you're more likely to conceive. It will tell you when your period should be, and it's really quite important for that, because some complications of pregnancy can happen before you realize that you're pregnant. So really important to keep track of your period, even if you're just popping it on the calendar. That's useful. Or if you just know, okay, I normally have it around the beginning of the month. Tender breasts, nausea, vomiting, feeling more tired, frequent urination, mild cramps. Some women have spotting, and people talk about an implantation bleed and, oh, it's normal. Bleeding or spotting in pregnancy is common, but it is never normal, never, ever normal. If you've got spotting or any kind of bleeding in early pregnancy, it's important to get it checked out. And the first thing we want to know is, where is the pregnancy located? Okay. A home pregnancy test, the ones we buy over the counter, they're becoming better and better at detecting pregnancy hormone. And so even before you miss your period, you can have a positive pregnancy test and you can know you're pregnant, and you could be aware of what's happening in your body. Okay, so there are a lot of hormonal changes, particularly HCG, estrogen, and progesterone. And these hormones begin to rise, causing various effects in your body. The embryo implants and the placenta starts forming. Your blood volume rises, so you'll see that your veins look bigger, but with that widening of your vessels and the blood volume increasing, your blood pressure tends to get lower. So just be careful how you sit up in bed, because you can feel dizzy, and that's normal. So for somebody with high blood pressure, your blood pressure is going to get lower, and before it gets higher later in pregnancy. Your bowels become more sluggish. So really important about keeping that fiber in your diet, because the progesterone hormone makes your bowels more sluggish, more likely to get constipation. So there's a lot happening in your body at that point. So the early weeks. So pregnancy is dated from the first day of your last period, which is why it's really important to keep track of your periods, but also the length of your period. And we know that on the first day of your period, you're not actually pregnant, but this is classically how we've calculated it, because obviously in the past, we didn't know when women were ovulating, and I'm talking about well in the past. So we calculated the pregnancy based on the first day of your last period. Now, in a woman who has a 28-day cycle, meaning 28 days from the first day of one period to the first day of the next period, she'll normally ovulate on day 14 and conceive at that time. So we know that even though we might say somebody is 2 months pregnant, We know those first 2 weeks were not actually a pregnancy, hadn't yet started, but it's part of how we count the pregnancy. So we add on those 2 extra weeks. So we consider between 0 and 12 to 13 weeks the first trimester. Around 6 weeks on ultrasound, we can see the heartbeat. By 12 weeks, a lot of the organs, almost all the organs are formed, but during the rest of the pregnancy, they're developing and becoming more complex for the functions that they will be occurring later on in life. And the dating scan is done somewhere between 12 and just under 14 weeks, which is when some screening tests are done for your pregnancy. So your first appointment. Now, as soon as your pregnancy is confirmed, you can refer yourself to antenatal care, or your GP can do it. And a lot of hospitals have a form online that you can refer yourself in for your antenatal care. And then your midwife sees you at around 9 weeks, between 8 and 10 weeks. And what she does is some tests and some screening. So we do some blood tests to check for anemia, because if you're anemic at that point, it's going to get a little bit worse, because as I told you, the blood volume expands. So the concentration of your blood gets less. So if you're already anemic at the start of your pregnancy, it's going to get worse. So it's important for us to start optimizing your health in early pregnancy. We check your blood group because it's important about your rhesus status for us to know if we need to test what baby's blood group is, so that your blood does not interact with baby's blood. We also screen for infections to see if there's anything we need to treat. We check for urine infections, because you can have a urine infection and not realize, because during early pregnancy, you have a slightly higher risk of infections because your body is reducing your immunity so that you don't attack your pregnancy. Then there's a risk assessment done, and it's a full history, not only of you, but of your partner as well. And the reason for that is because they want to assess what risks you might have for you in the pregnancy, but also any risks for the pregnancy itself, for your baby. Are there any conditions that your baby might have that they can screen for and help you in the pregnancy? So it's a full screening. Then there's lifestyle, review of what supplements you're on. Are you taking your folic acid? Any advice? Sometimes if you are, for example, at higher risk of raised blood pressure or something called preeclampsia later on in pregnancy, then we might put you on aspirin earlier in pregnancy to reduce that risk. So there's a lot of risk assessment that's done. So it's a really, really important appointment. And then they plan the future appointments. They let you know how often it'll be, assuming everything goes to plan. And then if things don't go to plan and new things happen along the way, then those things can be changed. But they give you a plan so you know what it's going to look like for the coming months. Okay, really important to look after yourself. Women, we are often quite selfless, and we think, okay, it's just about the baby, it's just about the pregnancy, but you have to look after yourself in order to look after your pregnancy. So you need to be taking that folic acid. You need to be taking that vitamin D. It's both for the baby and for you, because low vitamin D is going to make you feel even more exhausted than the pregnancy itself is making you feel. Balanced diet, keeping hydrated, avoiding undercooked meat, unpasteurized cheese, high mercury fish are just some of the food stuff we recommend to avoid. I've mentioned the alcohol and smoking already, recreational drugs. We don't recommend that. And some exercise is safe. You can exercise during pregnancy, and in fact, it helps you prepare for the birth and the rigors of having a newborn and a young child at home. Really important to get your rest in, to try and find that balance as you go along your pregnancy. So, some common early pregnancy symptoms and what to do about them. Fatigue due to the hormones, rest, light walks. You don't want to completely stay lying down. That increases the risk of clots in your legs, but you don't want to overdo it and just be rushing about. So it's about trying to find that balance, taking walks, moving around, and increasing your stamina, let's say, during your early pregnancy. If you have mild nausea, it's usually due to the hormones, yes. Small frequent meals. People talk about ginger. Vitamin B6 has been known to help reduce that mild nausea. I will talk about more severe nausea later on. Constipation, I've also mentioned that. Due to the hormones, it's all the hormones, okay? You need to increase your fiber, increase your fluids, and if you still need further help, there are safe medications that we can use to help keep your bowels moving. Breast tenderness, really important to get a supportive bra. Mood changes are very common and it's normal. It's the hormones, it's the stress, it's about planning. And it's really important to be kind to yourself and get the support that you need. You can talk to your GP, you can talk to your midwife, and then they can give you advice of whether you need something more for support for you. And spotting or bleeding, it's common, but it's not normal. You get referred to an early pregnancy unit or an early pregnancy doctor and you check. And the first thing we want to check is, where is the pregnancy? We want to make sure the pregnancy is in the right place, and then they can give you advice later on about what to do about that spotting. Okay, when to seek help. So you contact your GP or the early pregnancy unit or A&E if you have pain that's increasing and if it's particularly on one side of your abdomen. So one side, either the right or the left, that becomes a little bit more concerning. If you have any bleeding, if you have pain in your shoulder, and that might seem strange, you wouldn't think, why should I worry about shoulder pain if I'm pregnant? And that's because if there's any bleeding from a pregnancy that's not in the right place and it's bleeding into your tummy, it can irritate the top of your tummy, which can be felt in your shoulder. Diarrhea. Same thing, if there's bleeding inside of your tummy, it irritates the bowel and it causes increased transit of your bowels and causes diarrhea. So if you have diarrhea and it's not that everybody in the house has diarrhea, then it's important to get that checked. And that's mostly about the location of the pregnancy. So if we already know your pregnancy is in the right place and you have diarrhea, then we're not worried about an ectopic pregnancy, but you should still get that sorted because you don't want to get dehydrated. And then fever or pain when passing urine, that would be a possible urine infection. We don't want to leave infections in the pelvis or near the pregnancy, or any infection really for any length of time. We really want to get on top of it because we don't want it to affect the baby. Good. So now I'm going to talk about some difficult experiences that may occur, how to recognize them, and options for you. The first one is the ectopic pregnancy. And this is the most serious one of them all for us and for you. And this is the one why early pregnancy units were first set up. Because the first thing we want to know is, where is that pregnancy? Is it in the right place? So inside the uterus, this is where the pregnancy should be. If the pregnancy is anywhere outside of the endometrial cavity, that is an ectopic pregnancy. The most common place is in the fallopian tube, and this is where the egg travels from the ovary into the cavity of the womb to implant. But if it implants along the way in the tube, that's an ectopic pregnancy. Sometimes it can implant on the ovary. That's also an ectopic pregnancy. And there's some other unusual places that it can implant, like a cesarean section scar. And basically we want to know, where is the pregnancy when we see you for the first time. The symptoms are pain on one side, because if it's in the tube, it will tend to give you pain on that side. Vaginal bleeding or spotting, dizziness, fainting, collapse, and the diarrhea. These are the classic symptoms, and these are the ones you must look out for and get checked for. Treatment. Early diagnosis is so important, because if you don't get help or you don't know you have it, it can be life-threatening. After we do the scan, we do some blood tests. Depending on how high your hormones are, what the scan is showing, and how you feel, we have 3 options. And sometimes we can just watch and wait, and the hormone levels will fall, and your body will deal with the pregnancy on its own, and it will disappear, and you don't need anything major. And once it all goes away, then you can go ahead and get pregnant again. Sometimes we need to use methotrexate to help it go away. And methotrexate is an injection. It's a very strong drug. It's toxic to pregnancy, so you need to wait 3 months before you get pregnant again. And then sometimes we need to do surgery. And we do surgery if the hormones are very high, if it's too big, if it's bleeding too much. And your doctors will give you the advice. They will give you the options, and they will give you the advice and tell you what they think is best for you. If you've had one ectopic before, you can refer yourself in every single future pregnancy directly to any early pregnancy unit, because it's really important for us to check for you in every future pregnancy, where is the pregnancy? So as soon as you realize you're pregnant, once again, my plug for tracking your period, so you know when your period is late. As soon as you realize you're pregnant, you can refer yourself. We will do a scan and check where the pregnancy is for you. Okay, hyperemesis gravidarum. Basically, this is a condition that is more than morning sickness. It's more than the mild nausea. It's significant nausea or significant vomiting. You don't even have to be vomiting. It just has to be significant enough that it's interfering with your daily life. You can't do what you normally do. You're feeling too nauseous to eat enough or drink enough. And we very much depend on your self-assessment of that. The things that we can measure is looking to see, do we think you're dehydrated? Are you losing weight? But we really don't want it to get to that point. And I know I've heard women have told me that they're not believed when they go to accident and emergency. And so it's really important to document, if you can, every time you have significant nausea, when you vomit, so that when you go in, you can show them, this is what has been happening to me. I need help. Okay? If you've had severe vomiting in previous pregnancies, you can start medication in your next pregnancy before the nausea starts, or as soon as it starts when it's mild. And that has been found in studies to give you a better effect, rather than waiting until it gets really severe and then trying to regain that ground and get you back to feeling a little bit more like yourself. Now, I know that some women can be nervous about taking some of the medication, but we do have safe medications that we use for vomiting in early pregnancy. We have ones that we've used for a very, very long time. We have ones that we would only use in the 2nd trimester. You know, talk to your doctor, talk to your health professional, and we can give you the advice, because if you are so unwell that you are dehydrated and losing weight, it's also not good for your baby. So it's really, really important that you get on top of it and you feel okay. I mean, yeah, really important. Don't suffer because you're afraid to take medication. We are here to take care of you and your baby. Bleeding in early pregnancy. Now, bleeding in early pregnancy is very, very common, about 1 in 3 pregnancies. It can be a threatened miscarriage. It can be the ectopic pregnancy I've already mentioned. It can be a vaginal infection. You know, a really bad thrush can irritate the cervix and cause some spotting. It could be some changes on the cervix, which, you know, it happens normally in pregnancy. And it's really important to get that checked out. Contact your GP, contact an early pregnancy unit, contact your midwife. Not all bleeding means pregnancy loss. I have had patients come in to me and say, I bled, I think I've lost a baby, I went out drinking to soothe myself. And then I'm like, you're pregnancy's fine. It's fine. So don't suffer at home alone, worried, thinking you've lost your baby. Get it checked out, because it doesn't mean that you've lost the baby. Okay? Miscarriage. Now, miscarriage occurs in about 1 in 4 pregnancies, so it really is quite common. And it's often due to chromosomal abnormalities, which are beyond your control. They're random errors in the pregnancy. It's not something you did. It's not something you didn't do. It's not something you should have done. It's really nothing to do with that aspect of your life at all. It's random errors in the pregnancy most of the time. So most of the time, unfortunately, miscarriages in the first trimester, early pregnancy, there are very few things we can do for you. The most important symptoms is, once again, the bleeding. But if it gets really bad and you start passing clots and bits of tissue, then that would suggest that this might be a miscarriage. And the treatment options are, once again, those 3 options: watchful waiting, letting it happen naturally, using medication to expedite the process, or having surgery, which is a minor procedure done through the vagina, which can be done both awake or asleep. And the virtual reality headsets, what we did was, for the patients having the awake procedures who didn't want a general anesthetic, it was to help reduce anxiety. You have someone in to support you for that procedure. Now, for patients who have had a previous miscarriage, if you've had 1 previous miscarriage, there is some medication we can offer you to reduce the risk of miscarriage. Okay? Then we've got recurrent miscarriage, and this is defined as women who've had 3 or more miscarriages. We used to say they had to be consecutive, but now they've changed the definition to just having 3. So if you have 1, a normal pregnancy, and then 2, that is still considered recurrent miscarriage. On the NHS, unfortunately, we only investigate after 3, and some units only investigate after 3 consecutive ones, and that's just due to resources and managing resources. But what I can say about recurrent miscarriage is sometimes it's genetic factors, and so what we do is we check the genes for you and your partner. It can be hormonal, it can be thyroid, it can be antibodies in your blood, so we check for that. It could be the shape of your womb, and often when you go for your early pregnancy scan, we would often see an element of that and be able to tell you about that. It could be blood clotting disorders, what we call coagulopathies, basically meaning that your blood has a tendency to clot, and it's forming clots in baby's placenta and therefore not letting it grow. Now, most couples go on to have a healthy pregnancy despite those miscarriages. So like I said, the patient who's had 1 and then a normal pregnancy and then another one, or, there is hope. And the medication I mentioned is called progesterone. It's the same hormone that your ovary is producing for the early pregnancy. A huge study was done. The more miscarriages someone has had, we have found that sometimes they would be miscarrying normal pregnancies, and the reason they're miscarrying, we found that adding in progesterone, giving progesterone supplements, reduces that risk of miscarriage. So it was hugely significant if somebody had 3 miscarriages. It was kind of significant if they had 2. There was a slight benefit if they had 1, and that's just to say that a lot of miscarriages are just due to chromosomal stuff. And even if we give progesterone, it won't save that pregnancy, but we think it will help save the pregnancy that's normal and that is trying to go based on not having enough progesterone. I hope that was clear. Okay, your emotional well-being. Pregnancy is, or it can be, a very emotional time. And it can be joyful, it can be anxious, it can be stressful, it can cause relationship problems with your partner, with your family. You could worry about money and paying for, there are a lot of things that as women we consider. It's important that you get the support that you need. Even things like, and this isn't to talk about domestic violence, but even domestic violence, like, it becomes more in early pregnancy. And so if things are happening to you, talk to someone. Really, really important. If there's one thing you walk away from listening to me talk today, it's that as health professionals, we are here to help you and support you. And if you're not getting the help from one, you can check another. It's really important to get the help you need. It's also really important to disclose to your health professional if you have a personal or family history of mental health challenges, because it increases your risk during pregnancy. All those hormones putting you under stress on your body, it increases your risk of tripping you into having a mental health challenge. And it's not only during the pregnancy, it's also very much especially after pregnancy, like just after, when you are struggling with sleep and you've got this new baby to take care of, and it's, new challenges for you. So it's really important to take care of yourself, to let your health professional know so they can provide the support that you need to help you through that season so that you can go out on the other side without harm to you or your baby. All right, some myths out there. Some people say that exercise is not allowed. That's not true. Exercise is good. What I would say is, as the pregnancy gets heavier, you don't want to be doing heavy exercises that cause you to put a strain. When you lift something heavy and you kind of pull in your stomach and you squeeze your stomach and you squeeze your pelvic floor, those sorts of exercises you don't want to do, because it's putting greater weight on your pelvic floor, which, if your cervix is not strong, can lead to problems like in the second trimester and in the third trimester. But things with your arms, cardio, walking, things with your legs, absolutely fine. And it's good because it will give you the stamina for when you are ready to birth your baby. Morning sickness means a girl. No, it doesn't. That's a myth. There's no evidence for that. Eating for two. You're not eating for two. You are eating more, but you're eating, make sure it's healthy eating. You don't want to gain, you don't want to starve yourself. You don't want to not eat when you're hungry, but it's a balance, and your midwife can advise you along the way. Flying. Some people say you can't fly early. That's not true. You can fly. It's usually safe, and your doctor will let you know. The most important thing is we need to know where the pregnancy is. You can't fly if you've got an ectopic pregnancy that's being treated. You can't fly if you're having bleeding in early pregnancy and we're worried about a miscarriage. And that's because you don't want to have a miscarriage on a plane. But the flying itself is not a risk to the pregnancy. The risk for you is a risk of clots in your legs. So it's really important you wear compression stockings, that you walk around and exercise your legs, and you keep hydrated on the plane. If you're at a higher risk of clots, which is part of the risk assessment that your midwife does at your 9-week appointment, they will give you injections to reduce the risk of clots, to thin your blood a little bit so you don't get clots in your legs or lungs. I have patients who are afraid of having a transvaginal ultrasound scan, and they think that it would cause a miscarriage. It does not. We use safe settings. We have settings that we use specifically for early pregnancy. We don't use Doppler to listen to the heartbeat. So you might ask the doctor, oh, I can see the baby's heartbeat. Can I hear it? We won't let you hear it when we do a transvaginal ultrasound scan, because that is a high energy setting, and we don't want to use that for your baby. So it is safe in pregnancy because we use the correct settings, and we don't use the high energy ones that will impact your baby. For your friends who might say, well, I went and I had a transvaginal scan and then I miscarried the next day. It's not the transvaginal scan that did it. What did it is they came for the scan because they were bleeding. And then they went on to miscarry, and the scan was just something along the way. It is not the cause. It's not the cause of miscarriage. Okay? Avoiding sex. Sex is safe during pregnancy. It's your choice. The only time your doctor may tell you to avoid it is if later on in pregnancy they've said that your placenta is low, or your cervix is opening or shortening, or they put a stitch in your cervix. Those are the times that they will tell you to avoid it. So it's up to you how you manage your relationship with your partner, but sex will not damage your baby. Okay? All right, so the joy of early pregnancy. It's a beautiful time. Baby's organs are forming. There are a lot of changes that are happening in both your body and in baby's body. It's really important. There are a lot of studies coming out about how you eat and how it impacts your baby's health in the future. But at the same time, be kind to yourself. Support your health during that time, which will also support your baby's health for the future. Celebrate the steps along the way. Create great memories, document things, get a diary, really enjoy that time, but always be gentle to yourself. Be kind to yourself. Don't say anything to yourself that you wouldn't say to your friend, okay? So my summary is use reliable contraception if you don't want to get pregnant, or if you have any medication that needs to be managed prior to pregnancy. Optimize your health prior to pregnancy. You want good blood sugar control, because if your blood sugar control is not good, it can impact the organs of your baby. Plan when you want to get pregnant, and start your folic acid early. Know the early signs so you know when it happens. So track your periods, please. Attend your appointments. Every appointment has a purpose, and there's a reason why we want to see you at that point in time. Listen to all the instructions. Check all the information that we give you to know when to come in. Look after your body and your mind, not just your body, your mind as well. Seek help for pain or bleeding, and no question is too small. If you've got a question, you ask your midwife, you ask your doctor. We are there to support you. So thank you for listening. I'm just going to put it through because I know they're recording. These are some links or some pages that can give you additional help. So Healthy Start, about food, talking therapies like IAPT if you need mental health support. These are just some really good, Kicks Count, Action on Preeclampsia support. If you have preeclampsia, antenatal screening, Tommy's, Mother-to-be, Bumps, talks about medicines in pregnancy, so you can get even a better understanding yourself about your medication. Pelvic floor exercise is really important. There's Squeezy Connect, which is a free app. Physiotherapy, 5 times more, is about improving health outcomes for Black women, because we realized in one of our studies that Black women were 5 times more likely to die, which is really, really sad. And finally, a light has been shone on it, and we are trying to do better. And so information that you give back to us is really important about how health professionals can improve. And then the Twins Trust. And that's it. Thank you very much.
Thank you so much, Dr. Natalie. That was a brilliant, brilliant presentation. I definitely learned a lot of things from there. I'm sure others did too. getting pregnant, I assume, is a very exciting time for a lot of people, but also very daunting. People might have a lot of questions. So thank you so much for shedding some light on some things that is useful for people to know and busting some myths. Like you said, the statistic about Black women being 4 or 5, I can't remember the times.
It was 5 at first, and they've
5.
made a couple of changes, and now it's come down to 4.
Okay, well, that really shook me when I first heard it and saw it. So it's very important that people are educated and we're having steps to help improve that statistic in the long run. So thank you so much for that. We've actually got quite a few questions in the chat.
Okay.
So if you wouldn't mind answering. So we've got the first questions. Do Black women experience any unique symptoms or health challenges in the first trimester? And what could be behind that, like to Black women specifically?
That's a good question. I don't know of any unique challenges that Black women have in the first trimester. What they do have is more things later on, like preeclampsia, or if they've got diabetes or fibroids, maybe, because Black women are more likely to have fibroids. So if you get pregnant with fibroids, there's some unique things about that in terms of symptoms that you may experience, like you may have more pain with fibroids, or increase the risk of miscarriage with the fibroids. So I would say that perhaps fibroids might be and raised blood pressure would be the things that we Black women tend to have more of, and therefore may complicate an early pregnancy.
Okay, thank you for that. Another question. What are some early signs of pregnancy that people often overlook or mistake for something else?
Interesting questions. Okay, so there's something called tyolism, which is excessive salivation. And so that is one of the early signs of pregnancy that that people may not realize, that they're just salivating a lot more than normal. And changes in your body in general, like you can have a slight increase in temperature. So really subtle things. So some people who use those like Oura rings or Whoop bands or those sorts of things, they sometimes pick up things that you may not realize. So one of the subtle things is that slight increase in temperature because your progesterone is higher. But nothing that's the biggest thing, nothing there that confuses you into thinking it's something suspicious or worrisome, apart from the diarrhea, and if it's an ectopic pregnancy. And so somebody may have diarrhea, and I've seen too many times patients come in with diarrhea, or they come in with anemia, and it's because they've bled into their tummy, and we may miss it.
Yeah.
And even doctors may miss it, I'm sorry to say, because they get so caught up in it's diarrhea. Have you eaten something bad? And instead, it's actually an ectopic inside of your tummy bleeding, that you are so handling your pain, you think the pain is the diarrhea, that you miss that. And so that would be the main one, I would say.
Okay. Well, thank you so much for that. Yeah, so like subtle changes, so for people to look out for that. And we've got another couple questions from Hannah in the chat. She's got a few, so we'll just ask them all.
Okay.
This question is it advisable to go for private scans in the first trimester? And also, what is the typical timeline for when an expectant mother must go for scans? Like, are there any set dates?
Yeah. You don't need to go for private scans in the first trimester. Some women do because they want a reassurance scan, and you can't just get a reassurance scan without some sort of history. But if you have bleeding, you don't need to go privately for that. You can get that on the NHS.
Okay.
But if you want to just check and see your baby, then around 6-7 weeks is when we see the heartbeat. And it's really a really sweet time, if everything is going okay, to see your baby. You can see the whole baby on the screen, as opposed to by 12 weeks, the baby's so big, we're kind of seeing just the head or the tummy or the back or so forth later on in pregnancy. So you can go for a private scan at around 6-7 weeks. Probably 7 weeks is the kind of great time to see your baby. But if you have problems or health conditions, you can get that on the NHS. Now, the standard times for scans are the 12 to 14 weeks, where they look at a fold behind baby's neck and they do screening for chromosomal anomalies. Then they do a scan around 20 weeks to look for other anomalies. So they look at baby's heart, baby's brain, limbs, and they look at all baby's organs. It's quite a long systematic scan to look for anomalies. There are some other scans that can sometimes be useful between the 12 and the 20-week scan. And that is if you have a history of second trimester miscarriages. And what those scans do is they look at the length of your cervix to make sure that your cervix isn't getting short. Because once you get beyond the 12-week point, the weight of the pregnancy can put pressure on the cervix. And if you've had treatment to your cervix because of colposcopy abnormal smears, if you've had a cesarean section when you're already fully dilated, all these things increase your risk of your cervix getting weaker. And so scans during the second trimester can look at the length of your cervix. So if you have a history of those things and you tell them, they will arrange that for you on the NHS. If you just want that checked, then you can do that privately. But if you have a history, we can do that for you on the NHS.
Okay, brilliant. That's really useful. Thank you. I hope that answered your questions, Hannah. We've got a few more. What are the simple and safe ways to deal with morning sickness and tiredness without using medication? Because I know you mentioned on your presentation medication, but is there any non-medical medication ways?
Yeah. So what you can do is look at the things. It's important to kind of assess yourself, reflect on what things did I eat that triggered the nausea? What times of the day did I have it more? Some people talk about eating like all they can eat is gray food. So you want things not to be too oily because the oil kind of makes the nausea worse. You want it to not be too spicy. Like dry things, crackers, that sort of stuff, making sure you get the calories in, small sips throughout, constantly sipping throughout the day to get those fluids in. So just as you assess that, people talk about ginger, the C-bands with the acupressure points. And I think there was actually a study that showed that, one study showed that ginger does help. And vitamin B6. So like even one of the antiemetics we use has vitamin B6 as part of it because it does help reduce nausea. So those are the kind of natural, non-medicinal options to help you.
Thank you for that information. We've got a question from Anaic on the chat. She asks, can a woman who is pregnant for the first time experience very low platelet counts in the first month? Have you ever seen that before? Is that common or?
That is not a specific thing. It's not like every first time mother gets low platelets. That would be a very specific thing. So your hemoglobin does fall, your platelet count generally stays quite stable, and we have a normal range that it should be in. And if it's falling below that range, then you would be investigated to see whether it's ITP. This is in conditions that can cause your platelets count to be lower in early pregnancy that carries on throughout the pregnancy. So it's not a specific thing that pregnancy lowers your platelet count.
Okay, it's not common. So it's very important to recognize when things aren't like out of range so that
Yeah.
you can get that early. So thank you for that. We've got another question on the chat. The question is, if an expectant mother travels a lot for work, like traveling to different countries or to different cities, when do you advise best for her to stop traveling or minimize the traveling?
So it's difficult when you travel a lot for work. And there are general rules for airlines. Airlines will say up to what gestation they will allow you to travel, and your insurance will cover you to a particular point. It's difficult. So you can travel up to somewhere around 30 weeks, somewhere around there. But traveling a lot, being up in the sky a lot, the risk of clots quite high. Radiation is higher up in the air. I would explore. There's no perfect answer to that. That's something I would say you should discuss with your obstetrician, but also your occupational health, your manager, to see if they can reduce the, not just when you stop, but reduce the amount of travel, from, reducing it in the second trimester and then looking about stopping later on in the third.
Okay, yeah, I guess there's no right or wrong answer, but
No.
associated, and if there are options, whether like to work from home or
Correct.
to traveling, to definitely explore.
Yeah.
Okay, we've got another question, which is probably quite personal to most people, but in your experience with dealing with early pregnancies and families, what would you recommend, or what would you say is the best way for partners, friends, or families to give real, useful, helpful support to a woman during these first few months?
So I think that for partners and for family members to give support, there has to be communication. The woman has to say what it is she thinks she needs. So if she's having, excessive vomiting and nausea, she's probably going to be too tired to get up and cook and to do some of her other things that she needs to do. So it'll be really useful for partners to support and carry some of the load that she would normally be carrying when she's feeling a little bit more tired and not feeling herself. And family members, I think being there, and as you talk, then you'll understand what somebody needs. Like, do you want your friend to bring you over some food, to cook something for you because you don't want to get up and cook, or come with you to appointments because you want that support of somebody there with you when you're, to listen for you, because there's so much information that's given, you may miss some of it. So somebody there to be a second pair of ears. So really important for somebody to come along with you to appointments. So I think each individual, it'll be different. So just kind of have that communication and tell your friends, or if you are the friend, ask your friend, what would you like? Do you want me to do X, Y, or Z for you? Or what would you like me to do for you?
No, that's great advice, because I don't know about you, but I'm someone, I don't always voice what I want or communicate that well. Just magically expect people to know what I want. So if you are struggling or you have needs, to communicate that to friends and partners, and friends as well, to try and actively ask if the person is not being forthcoming with what they want, just be there as well. Just someone to talk to. I guess in this age of technology and social media, there's so much stuff, misinformation out there. So I feel like people going through pregnancies would probably be quite scared, all this information, what's wrong, what's right. So just keep communicating and stick to reliable sources, your doctors, experts, and not just believe everything that they read. But yeah, I think that's all the questions for now.
Okay.
Dr. Nunes. Thank you so
Great.
much. That was brilliant. I've definitely made some notes for the future, not for but thank you all so much for tuning in. I hope you learn something that you can pass on to your friends, to your family. And yeah, this is what these sessions are for, to learn, to be educated so that we can share what we've learned with our community.
Yeah.
I'm going to pass over to Sam now, who's just going to round it all up. Thank you everyone so much for tuning in, and have a wonderful Saturday. Thank you.
Okay.
Thank you very much, Amaka, and thank you very much, Dr. Natalie. As Amaka echoed earlier on, it has been a very educational session. I am not quite there yet, getting ready to experience a first trimester with a partner. But I will take this information on board for when the right time is, and I'll come back and watch this health hour over and over again, so I'm well informed. But truly, it was a very full session of information shared. So thank you very much for that. I'm just going to quickly go through a few things happening here at Khan. If you just bear with me, I'm going to whiz through these very quickly. Just sharing my screen right now. As you know, technology loves to act up the most when you need it, exactly. So yeah, just bear with me. Just going to do this slide here. Share screen. Perfect. Okay, thank you very much, everyone, for listening to this session. We do really appreciate that. Next week, we will be having Health Hour again. This session will be on November. Sorry, my system is not cooperating with me as I would like it to. Okay, let's try this again. Okay, just bear with me, guys. Sorry about this. Okay. So yeah, next week we'll be having November another Health Hour session delivered by a Dr. Olu Femi. So yeah, a great session. November, you know, as men's health is around the corner. Most people don't shave during November, so we have created this health hour so we can have an opportunity to talk with our community about mental health and the importance of togetherness and staying strong. We also have released a fibroids report, which was informed by 500 participants. As mentioned earlier on by Dr. Natalie, fibroids do have an impact on those that do get pregnant. So we thought it's very important that, you know, as the APPG on Black Health, take a look into fibroids, because there's not much research on fibroids. And from this slide and from the key findings that we found that there was only 6 UK-based research between 2014 and 2021, so that's like 6-7 years of not much research done, to be honest with you. Six studies is it's not enough to find out how fibroids affect Black women and how fibroids affect women in general. So this is something that we wanted to address by bringing it to the APPG on Black Health, and we conducted a full report, which you can find on the link there. I'll also put these links at the end of the presentation into the chat if you want to take a look at these links in a more closer detail. We also found out that 27% of respondents were not offered any treatment after being diagnosed with fibroids. As you know, fibroids can be quite debilitating for those experiencing it. So 27 of those people out of 500 not having any support or any treatment is quite overwhelming when you think about it in that spectrum. But please do have a look at this report, and I'm just going to go through to the next slide. So Black History Month has just ended last month, but you know, as an organization where we are trying to eradicate health inequalities, we love to celebrate our culture, we love to celebrate our people. So we did create this resource of Black History Month Media Toolkit, which you can find on www.bhm Greater Manchester greatermcr.com. Please feel free to have a look on the toolkit there, where you can find various resources as well as events that are going on in October and also in November, celebrating Black History Month. And we thought it's important to highlight this to the wider community. So we do have a project that is going on currently in Lambeth, Southwark and Lewisham, and mainly in South London as well, including Croydon. It's the Safer Home Project, where we are trying to address a couple of the issues that we might experience during this cold climate that's coming around the corner, autumn, winter time. a lot of families will be facing a lot of high fuel costs. So we have teamed up with SGN through Cadent to further promote the importance of learning how to be more energy efficient during the season, having some carbon monoxide alarms, or being aware of what carbon monoxide could do in your homes. There's some stark cases out there where families have been lost due to not knowing that they had carbon monoxide poisoning in their home and just living with it. So it's important that we're raising awareness about carbon monoxide alarms and also providing safety alarms being delivered by our delivery team. Income maximization during this winter period is quite important, as we all know that cost of living and fuel crisis that we're all experiencing can be quite strenuous on families and individuals. So there are systems out there that can help us navigate these things with a bit more ease, as well as the Priority Service Register, which is a free support that's available on the internet at dpsr.co.uk, where you could go in there and find out if you're eligible. The eligibility criteria is quite large, so you may or may not be eligible. As we're talking about the first trimester today, I know that families that have babies and children under 5 do qualify for Priority Service Register, which basically means if there's going to be an outage or there's going to be an issue with the grid, whether that's the water grid or the electricity grid or the gas grid, you will be informed and you'll be looked after by SGN or any other gas provider within your local area. So please do look into that, and I'll put the links in the chat, as I said earlier on. We do have a wonderful event happening in just about 14 days. So we're going to be celebrating the Manchester Health Festival, connecting the communities and doctors. So this is in collaboration with MANSAG, which is the Medical Association for Nigerian Specialist GP Practitioners in Great Britain. A very great association, a lot of cool doctors that I've met through there and I've met on there that have also come on Health Hour. So if you are interested in connecting the community, come and learn about, potential career stalls. If you want to get into healthcare, or if you want to learn more from GPs or doctors or nurses or healthcare professionals that look like us and sound like us and understand where we're coming from, such as Amaka and Dr. Natalie. So this is a place to interact with them and, come and have some fun. There's going to be free health checks. It's going to be an inspiring day of collaboration and meeting the community. It's going to be some live music and it's just going to be fun. So come along, have a bit of fun this mid-November, and it's on the 15th of November from 11 a.m. at the World Harvest Christian Center in Manchester. So yeah, thank you very much for listening to the Health Hour today on the first trimester. I think it's been quite an important session. The links will be available on YouTube, and I will put the rest of the links of the presentation from what I've just said in the chat. So feel free to have a nosy on that. And yeah, thank you very much again, guys, for tuning in to Health Hour today.
And that's our time for today. Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.